Well, Dr. Grabowski, I really appreciate you making time to be here tonight. Thanks.
Thank you, Rachel.
Congressman CLYBURN opened the hearing by saying that nursing home deaths account for 40,000 deaths of among the roughly 113,000 Americans who have died already. Do you think that's accurate? Do you think we have a general true sense of the scale of the problem in nursing homes and how many people have died there from this virus?
We actually don't have a full count, and that's incredibly sad. You mentioned earlier just the issue with the incomplete data. So we started back in March with this pandemic. The federal government wasn't recording data. They finally put together this national database here in June, actually, sort of late, starting at May 8th into June. And we don't have a complete record going back to the start of this pandemic. It's absolutely ridiculous. So with 40,000 deaths, that's actually probably an underestimate to a lot of us.
We've seen the federal government not do very much when it comes to nursing homes, particularly, from my view, given the scale of death in these facilities, just how many Americans have lost their lives, how many infections there have been. We have seen a sort of highly publicized effort from the federal government to send boxes of PPE to nursing homes. There's been some pretty harsh coverage over the past few days, though, that it seems like a lot of what the government has been sending to individual homes is not expected. It's not designed to meet the specific needs of those homes. And in some cases, it's junk, or at least unrelated to the needs of a typical nursing home in terms of how they serve their patients. What do you make of that effort? Should the federal government even be trying to do that? Or is it just that they should be doing it and they're just failing to execute?
The federal government should absolutely be providing PPE to all of our nursing homes across the country. The federal government, as you mentioned earlier, agreed to provide 2 weeks of PPE to every nursing home in the country. Clearly, nursing homes need more than 2 weeks, but at least that was a start. However, most of the PPE that has been shipped is actually unusable, and then some nursing homes are actually still waiting on that PPE. This is part of our national shame around this issue. PPE is the #1 weapon towards fighting the virus in nursing homes. The fact that we're sending out our workers, these staff who are heroes, they're not always appreciated as much as other kind of direct caregivers, but these nursing home staff are heroes. They deserve PPE. They deserve testing. We need to make certain that we have PPE in every nursing home in the country. And the fact that we're shipping, chlorified garbage bags to our direct caregivers is absolutely unacceptable.
I feel like anybody flipping the channels and coming across this discussion that you and I are having right now might think this show is a rerun. Because the discussion about not having the importance of PPE and not having PPE and needing to get PPE to frontline providers who don't have it feels like a discussion that we had as a country in March. We've stopped having that discussion. People assume that means the fix, that things have been fixed. I mean, setting aside whether or not healthcare workers in hospitals have adequate access to PPE, which is a whole other discussion, I just feel like this nursing home situation sort of advanced in public consciousness enough to define for people what the problem is, and just zero progress has been made toward making things any better, toward getting testing into them in a systematic way, toward getting them PPE, toward getting them the support that they need, toward getting them the staffing support that they need to be able to properly care for this incredibly vulnerable population. I despair that things aren't getting better after all this time.
I completely agree on that point. We've been in loop now for weeks, literally. We failed to learn back in March from the lessons in Europe and China. Then we failed to learn over the last 3 months from the lessons of Kirkland. And so basically, as you just suggested, Rachel, we're basically in the same place we were 3 months ago with testing and PPE. At what point are we going to start paying attention to nursing homes? You can't ignore this. If you want to contain the coronavirus in this country, it starts with nursing homes. That's where the cases are. That's where the deaths are. That's where we need to put our resources and our attention.
Yeah, and it's not going to come from the top down. We cannot count on the federal government, which oversees these facilities, to get this right. They have proven that now, and the energy here is going to have to come from somewhere else. Dr. David Grabowski, professor of healthcare policy at Harvard Medical School, I really appreciate you being here tonight. I get very upset about this issue, but your clarity on it is really helpful and grounding. Thank you.
Thanks, Rachel. I appreciate your attention on this issue.